So on the occasion of World Patient Safety Week, we welcome you to the Knowledge Series webinar on medication without harm from Apollo Hospitals. WHO has introduced the third Global Patient Safety Initiative as Medication Without Harm. They have developed a campaign to increase public awareness on the safety issues related to medication use. WHO aims to address the challenge with strategies for safer medication practice to reduce the risk of polypharmacy, high-risk situations, and transition of care, for example, through medication reconciliation. Both patients and healthcare providers have a crucial role to play in ensuring medication safety. The call for action for global campaign today is No Check and Ask. The topic for today is Newer Perspective on Medication Safety Program, the 10-step guide for implementation and improvement. During this session, we shall discuss a few global learnings related to newer perspective on medication. Can I request all of you to please mute on your mic?
You are on mute, ma'am.
Turn off பண்ணிட்டீங்களா? இல்ல Zoom இல்ல போல இருக்கு.
Can I start from the beginning then? Vicky?
Yes, Rekha, you can start.
From the beginning?
And I request everyone to please put your mic on mute, please, so that we can, begin the session.
Can I start from the beginning? Dr.
Yeah.
Sanjay?
Yes, Rekha.
Okay, sure. On the occasion of World Patient Safety Week, we welcome you to the Knowledge Series webinar on the medication without harm from Apollo Hospitals. WHO has introduced the third Global Patient Safety Initiative as Medication Without Harm. They have developed a campaign to increase public awareness on the safety issues related to medication use. WHO aims to address the challenge with strategies for safer medication practice to reduce the risk of polypharmacy, high-risk situations, and transition.
Request people who are controlling this, please mute everybody. All of you, please mute yourselves. That would be very helpful. Dr. Sanjay, can we please do it from the back end?
Sure.
Go ahead, Rekha, please. Sachin, can you please mute yourself? Akash.
WHO has introduced the third Global Patient Safety Initiative as Medication Without Harm. They have developed a campaign to increase public awareness on the safety issues related to medication use. WHO aims to address this challenge with strategies for safer medication practice to reduce the risk of polypharmacy, high-risk situations, and transition of care, for example, through medication reconciliations. Both patients and healthcare providers have a crucial role to play to ensure medication safety. The call for action for today's global campaign is No Check and Ask. The topic for today is Newer Perspective in Medication Safety Program, the 10 steps to guide for implementation and improvement. During this session, we will be discussing few global learnings related to Newer Perspective on Medication Safety Program. And at the end of the session, we are expecting the participants to know about how to take care of the risk factors related to polypharmacy, the importance of safe medication practice and its implementation strategies, and also to recognize the physicians, pharmacists, and nurses' role in the whole process. The speaker for today's session is Dr. Mohammad Ziauddin and Ms. Bhagya Lakshmi. Dr. Mohammad Ziauddin is an MBBS and MD in pharmacology and currently working as a consultant pharmacology and head of the department at Apollo Hospital, Hyderabad. He has 8 years of experience in medication management process in the hospital, which includes medication safety, healthcare quality improvement, pharmacovigilance, and quality accreditation process, which includes JCI and NABH. He has also an experience in institutional ethics committee for clinical studies and biomedical research as a member secretary and also as a basic medical scientist. He has also a teaching and clinical research experience in pharmacology and other areas. He has contributed and received several healthcare awards. He has also organized and contributed as a speaker on various international national conferences and webinars and educational programs. With this introduction, let's begin the presentation with Dr. Ziauddin. Over to Dr. Ziauddin.
Very good afternoon to all of the participants, and it's a very important subject related to the medication safety. Hope the slides are visible. This topic which we are going to discuss on medication safety in today's knowledge webinar series is the newer perspective to medication safety system, which we are going to depict you, that which I am going to tell you on the 10 steps guide how to implement and improve the current medication safety system. So the whole process which I'm going to discuss, the presentation which is based on the WHO strategic framework of the global patient safety challenge. When we say challenge, it's a main safety patient safety challenges, which has been given as a framework for World Health Organization, and which also has 4 domains in which medications can cause inadvertent harm. And 10 steps guide. So the guide which I guide from this particular framework, the guides which can be implemented and improved in medication safety. In this guide wise, each guide, stepwise guide, what we need to achieve and how what are the commitments required for a particular step guides to implement and improve in the medication safety. The goal of medication, WHO Global Patient Safety Challenge, the medication without harm, is to strengthen the systems for reducing medication errors and avoidable medication related harm. Reduce the level of severe avoidable harm related to medications by 50% over 5 years globally. The challenge aims to make improvements at each stage of medication process, including the prescription, dispensing, administering, and monitoring and use. So this is the strategic framework which depicted from the WHO strategic framework, which has an outer circle which involves mainly the collective leadership, human factors, e-health technologies, and quality improvement. The inner circles, which has 2 subdomains. The 4 domains of this particular strategic framework is one is the patients and the public, where we focused on increasing the patient awareness, medication literacy, and engaging the patients in their medication treatment, care, treatment and care, reporting of by the patients, reporting where there is issues related to the medication usage or medication errors or reactions, involvement of patients, organizations into this particular domain. The next sub-domain where there are important team comprises is the healthcare professionals, which comes as education and training, communication, and teamwork, capability of point of care and incident reporting. Next subdomain, domain is medicines, which has subdomains like reducing the burden of avoidable harm from the high-risk medicines, product safety and quality, and naming, labeling, packaging, logistics, right product at the right point of care. The next third domain, which comes as systems and practices of medications, which involve the subdomains like monitoring and evaluation, administration and patient monitoring, prescribing, preparation, dispensing, leadership, and governance. The 3 challenging areas which the requirement of the challenge for the most of the countries are, as noted, is and commented by WHO as the 3 target priority areas. The one which is the errors involving during transitions of care, high-risk situations, and polypharmacy. The step 1 guide based on this, the first thing I want to start with the domain which is related to patients and public. So in patients and public, the first step guide which we look into the subdomain is the increasing public awareness of the importance of using medication safely. So what do we want to achieve here in this particular domain? So many patients, they feel that whatever the doctor has prescribed, whatever the doctor has given the treatment has to be followed and has to be continued. In this particular culture, like passive culture, where there is not much opportunity for a patient to participate actively. So that needs to be more of a role from the patient side, where patients need to be encouraged with their active involvement and the management of their medications, and move away from their passive culture where people do not feel able to ask questions to their healthcare professionals and feel that they must do as the doctor says, and which requires encourage and help the people to be more curious about the treatment. And then people should feel that they should be able to ask their healthcare professional questions about their medicines, raising the awareness about the medications usage and safety, empowering the people to speak up about their medications, and as well as the most important part is the reporting by the patient, which I will discuss in the next subsequent slides. The commitments which can involve to achieve this particular subdomains is the public call to the action, maybe the global campaign or a campaign specific to a country or a specific to an organization which can be rolled on. The like campaign of a WHO campaign, where they tell about no, check and ask campaign, which can encourage, which can be conducted, repeated annually, and a long-term safety culture which it's required to be changed, and medication safety wise becomes the social norms, and everyone understand that they have a role to play in patient medication safety. So the patients and the public are not always medication wise. They are too often made to be passive recipients of medicines and not informed, empowered to play their part in making the process of medication safer. So this is from the World Health Organization report, which says about the patient's awareness and required to be active role in the patient medication, which can be done by creating education campaigns and counseling the patients and encouraging the patient to know their medicines, keep their list, check what they're using. Is it the right medicine? Is it being used as a right way? Ask the healthcare professional if they are unsure about this. So everyone has a role to play to ensure safe and effective use of medicines. So step 2 in the guide, support the people to be more involved in decisions about their medicines. So what we need to achieve here is the help the people or the public patients to ask their healthcare profession questions and related to the treatment and care plan. And assist them to manage their medication safely and enable them to getting the best intended outcomes from the treatment. WHO has provided a tool which is the name is as 5 moments of medication safety, which is for the patients, families, or the caregivers, which has the informations, what types of questions can be asked by the patients or the families to the doctor, and what needs to be documented, and the involvement of the patients engagement in the medication treatment protocol. Commitments which require the collaborative involvement of organizations, healthcare, social care providers, patient groups, families, or caregivers to use this WHO tool. 5 moments of medication tool safety, which says about the 5 main categories topic, like starting a medication. What is the name of this medication? What it is for? What are the risks and possible side effects? Taking my medication, what should I take this? When should I take and how should I take it? And what side effects do I get it? Adding a medication, or do I really need to add any other medication? Can this medication interact with my other medication? Reviewing the list, how long should I take this medication? And am I taking the medication I know longer needed? If I no longer need it, stopping the medication, when should I stop? and if I have to stop my medication due to unwanted effects. So these are basically patient awareness, which is created with the medication safety, 5 moments of medication safety, making it more user friendly. Making the poster more user friendly. The World Health Organization also has come up with a mobile application which says about this particular 5 moments of safety, which is you can see on the screen. It names as WHO MedSafe, which is available on the App Store and Google Play, as well as the QR code. You can see, you can scan it, and if the patients, families, caregivers, healthcare professionals are encouraged to download this, which talks about the World Health Organization's 5 moments of safety, and it has a screen where 5 moments of medication safety. Any patients, if they're having a list of medication, then they can click this starting a medication, which asks the subsequent questions where they can answer this and adding a medication, reviewing and stopping, and they can save this particular list of their medication whenever they have a doubt or interact with the patients. Step 3, helping the patients to report issues and concerns about their medicines. So what do we want to achieve? We want to achieve by making the patient more able and confident to report problems with their medication use and help them reduce the avoidable harm. So early reporting from patients about the medication errors or the medication related concerns, reporting, and the reporting problems that have occurred or had us cause potential to cause harm. And reporting can help learn from the mistake by taking actions that can keep the patient safe in future. Raising public patient awareness of the benefits of reporting medication issues and support the patients to report issues and concerns by addressing the barriers to reporting. Where does our country stands in reporting areas? This is the code which I've taken from 2015 from one of the studies, which says that 10% of 3.63 trillion medicines which are popped worldwide in 2015. India is the world third largest medicine market. So we contribute around 10% of the total medicines worldwide popped up. Let's see how much of adverse drug reaction we report out of this. Yet in 2013, we have received that India has reported no more than 2% of globally occurring adverse drug reaction. This is as on date 2013, which I've seen in the below research studies which are published. So next, step 4, raise awareness among healthcare professional staff that the medication safety is everyone's responsibility. So the next domain which we have, the second domain, is our most important team, which is healthcare professional team, healthcare and our professional staff. What do we want to achieve is every healthcare individuals, we as a healthcare individuals recognize our role and responsibilities to ensure the medicines are used safely, reporting and learning from incidents where the harm has occurred or potential risks are identified, learning from excellence and best practices, and celebrating the things when the things go right, and medication safety culture and medication safety carnivals which conducted across the organization, which is very essential to have the safety culture in any organization. So commitments involving the healthcare professional in the delivery of WHO's No Check and Ask campaign, and also healthcare professionals report and learn from medication related adverse events, incidents, including near miss, competency framework to identify medication safety learning and development needs for current and future roles. So healthcare professionals sometimes prescribe and administer medicines, which in ways, circumstances that increase the risk of harm. So healthcare professionals sometimes prescribe and administer medicines in ways and circumstances that increase the risk of harms to patients, and no check and ask. Step 5, ensure the health social care staff have the skills to be medication safety wise. What do we want to achieve? Develop a self and situational awareness skills, which needs to be incorporated and made into the situational skills from the healthcare professionals, and so that they understand in which particular situation and what medication safety situations, what skills, what needs to be managed, how needs to be handled this. Medication safety education programs need to be incorporated in the training and the curriculum of this particular medical educations, and educational programs will need to continually evolve to equip staff with skills needed to respond to future technologies. And commitments incorporating principles of the revised WHO medication safety curriculum guide and human factors training within multidisciplinary medication safety program that are required responsive to future needs. So coming to the next domain, which is the systems and practice. So systems and practices of medications are very complex and often dysfunctional, and can be made more resilient to risk and harm if they are well understood and designed. The right side, if you can see this particular hierarchy, this is the hierarchy of intervention effectiveness. So what intervention and what effectiveness? The arrow mark desirable or arrow mark is upwards. The base, you can see it's the least effective but very easy to implement. So these are suggestions to be more vigilant, making the information more available, and creating more of an education or a medical education or CMEs or awareness safety programs to the healthcare professional, patients and public, rules and policy of an organization. So these are dependent on the human and human reliable points, which has least effectiveness but easy to implement these things. When we move little upwards, we see on the medium level of this particular interventions hierarchy, and with the effectiveness, we can see warnings, alerts, reminders, and checklists, like more keeping the warnings on high alert medications, alerting on the software or a pop-up alerts in the system of the hospital information system, and reminding about the due dose of the medication, timing of the medication, and implementing the checklist of the medications within the system, and doing a checks and redundancies and standardizing the protocols and across the hospital, and that also gives a very good effectiveness with the medium level of implementation. Let's see the points where you require it's very hard to implement but most effective. These are automation and computerization in the system, barriers and fail safes, and forcing functions. So these are mainly system driven, system reliable things which requires to be implemented in this thing. So human beings make mistakes because of these systems, because the systems, tasks and processes they work are poorly designed. So step 6 in this domain, which is a subdomain, I'm just going to introduce the systems to help reduce harm related to the prescribing and administration of medication. What do we want? We want a particular safe prescribing administration practices across the organization to help the staff to get it right the first time. And to do this through a standardizing of a practice which can improve the access to protocols, guidelines, and creating a better communication between the teams. And commitments required like electronic prescribing, electronic system where there is a prescription, digital prescription, and moving on from the handwritten or the manual thing to a digital prescription, and as well as electronic medication administration. And there is a closed loop of medicine administration system within the hospital, which can be implemented and improved, and the system can be made more robust and system driven. Prescribing decision supports, which can be linked with the artificial intelligence, where with the computer system and the prescribing becomes very predictable, and the decision can be more appropriate and clinically required for the patient. And also risk identification systems, where the risk can be identified with the help of the hospital information systems, and targeted improvement programs to reduce the number of inappropriate omitted doses within the hospitals. The step 6, which is one of the main priority area which the World Health Organization has pointed out, that is the safer transitions of care, which introduce a standard system for medication safety, a transition of care, which is transition of care, meeting the complex challenge of reducing medication related harm arising at the transition of care is very challenging, and it requires the long-term leadership commitments and coordination, collaboration, formulation of goals and strategies, and investment of resources which can be planned, and so that the errors which is occurring during the patient transition within the hospital. So what we want in this particular thing is the safer, reliable system whereby every patient every time has their medication reconciled when they are getting transferring between the care settings. It could be a patient who has come to the hospital, and at the time of admission, if the doctor takes a proper medication history and do a medication reconciliation, what is the medication you are on, and what is the when is the last dose date time taken, and whether that medication which the patient is on, whether to be continued during the hospital stay, yes or no, that decision making. And subsequently, if it is yes, that needs to reflect into the patient's active drug or treatment protocol or cardex or drug charts, where the treatment continues during the hospital stay. If it is not to be continued during the hospital stay, the decision made by the doctor, then the particular medication needs to be, if it is available in the physical quantity, needs to be resent or treated as a valuables, and do not use that particular medication during the hospital stay. So many at times during the new admissions or the admissions in emergency, there will be challenges which are there, which encountered due to this at the time of admission, where a doctor inadequately takes the medical history, do not take the complete medication reconciliation, or may not have accessibility or may not have the availability of the information what the list of medication this patient is on at the time when he has presented to the hospital. So medication reconciliation is very important at the time of admission, at the time of even outpatient review or a checkup. Then after this, a patient who has been taking the treatment in an intensive care unit, shifting out to another unit or a ward location, when he shifts that particular point, when there is a care setting being shifted or transferred, the reconciliation needs to happen at that transition point also, where it has to be looked into a detail, what is the point of medications which the patients needs to be continued further during the ICU setup, and the drug charts or the during drug treatments needs to be updated accordingly when the patient is at that particular ward location. Then the final comes where the patients get discharged, and at the time of discharge, when the patient leaves the hospital and leaves to their home, they need to have the complete list of medications in the discharge medications, which needs to be in sync with the medication which the patient is on the treatment during drug chart, keeping his clinical condition into mind. And then the discharge medication needs to be reconciled and handed over to the patient for further requirements. So this transition of cares and the check which requires a very long-term leadership commitments, coordination between units and the different team within the hospital, and collaborating on formulation of goals and strategies and investment of some of the resources which requires can be done to ensure the patients are safe during transition of care when they are, and the medication safety is addressed during the transition of care. Next important priority which the World Health Organization has highlighted in the Global Patient Safety Challenge is the polypharmacy. Polypharmacy, it's the list of many patients, if we see especially a targeted group of patients like elderly, will be on multiple medications due to their multiple comorbidities. So what do we want to achieve here is to build our existing examples of best practices and reduce the harm from inappropriate polypharmacy, and moving into and adopting a robust and consistent approach to medication review across the care setting, and ensuring there is an appropriate polypharmacy. There are prevalence of polypharmacy which increases with the aging group of patients because of multiple medication. Polypharmacy can be appropriate based on the clinical evidences, and due to some of the irrational prescriptions, many patients tends to be on many list of medications, which is a loop for having many errors during this particular many medication. There are chances of errors which can happen due to polypharmacy. What is the requirement commitments is reducing inappropriate polypharmacy medications the patient is taking. So ensuring medication safety in polypharmacy is one of the key challenge of our medication safety. 32% of patients receiving 5 or more medicines have prescribing or monitoring errors. This increases to 47% in patients receiving 10 or more medicines. 11% of unplanned hospital admissions are attributable to harm from medicines, and over 70% of these being due to older people in multiple medicines. So step 9, moving on to the next priority challenge, which is the reduce the burden of avoidable harm with the high risk medicines. So high risk medications, these are those medications which has a heightened risk of causing adverse outcomes when used inappropriate or when used due to error. So this medication, when it is used, when there is an error, and then the adverse outcome will be very significant adverse outcome which the patient can encounter. So this list of medication which is high risk or high alert, as referred or as also defined in the list of institute safe medication practices, which defines many list of medications, especially the narrow therapeutic medications, narrow therapeutic index medications, and the medications which are used in case of surgeries or operation theater sedatives, and neuromuscular blocking agents and insulin narcotics. So there are many list of just medications which are considered as high risk or high alert medications. Safe use of these medicines is very much required, and multiple approaches and innovative thinkings to address this inherent risk which is required to achieve. Commitments is targeted improvement program with the aim of reducing preventable harm associated with this high alert and high risk medications. That's to me done. Step 10, build good practice in medication safety into all supply chains. So supply chain of medication, which is very important. Supply chain needs to be very integrated and needs to have a timely, uninterrupted supply of safe, quality medical supplies, and which maximize the patient safety, ensure the product availability, identification of supplies under significant risk. Commitments to develop strategies that will prevent incidents involving look-alike, sound-alike medications. So medications which look alike and sound alike needs to have a strategy where we can prevent any incidents which is occurring due to this particular medication. Identification and management of medicines and supply chain issues, shortages, and risk stratification tools in primary and secondary care. So thank you. That's from my side. So I hand over now next to Bhagya for taking over into more of a nursing role in the medication safety and highlighting the medication errors and the challenges and what are the strategies need to implement and to mitigate such risk during medication administration and handling the day-to-day work in the nursing and ensuring the safe strategies are implemented and also steps to improve that. Over to you, Bhagya. Thank you.
Thank you so much, Dr. Ziauddin, for the wonderful insight on implementation strategies for improving and ensuring medication safety and for helping us understand the strategic framework for medication safety. Now let us welcome the next speaker of the day, Ms. Bhagya Lakshmi. She has been associated with Apollo Hospitals as the nursing coordinator for past 12 years. She has done her BSc nursing and also masters in hospital administration from Apollo. She has been actively participating in the different audit processes in the hospital, which includes Joint Commission International 360-degree audit, Nursing Full Circle audit, and also as an auditor in Nursing Full Circle audit. She has also published 2 articles in International Journal for Science and Healthcare Research, and she has also been a speaker in ISCCM Step-In session for nurses. Over to you, Ms. Bhagya.
Thank you, ma'am. Till now, we have seen how the system actually public and the healthcare system runs as a part of medication safety, which is defined as per the World Health Organization. As a nursing view, how the medication errors and the medication system works, I will be briefing on. So the error is human, as sir already telling, errors will happen with the humans and it is preventable by us only. So the error is human. To cover up is unforgivable. To fail to learn is inexcusable. Whenever there is an error, the moment we escalate, we'll understand by root cause analysis where error happened, how it happened. We can really identify where we are going wrong. So from each error, we can learn each step where we can prevent this error. Let us understand the process of medication administration. So medication management process mainly divided into 4 steps. One is prescribing, second one is transcribing, third one is dispensing, fourth one is administering. So we all know what you mean by prescribing. A consultant or a physician who orders a drug to a patient. It may be a consultant, physician or the anesthetist who is having a right to give a drug order, that is a prescribing. The chances, the moment doctor advises a drug, it goes to the transcribing. That means the order which is physically written, otherwise manually entered into the system, need to be translated to the pharmacy by a manual entry or the system entry, where the drug has been intended or billed onto the patient name. That is called the transcribing phase. Then it goes to the pharmacy. From the pharmacy, it will be dispensed to the particular patient. From the dispensing, it comes to the nursing. It may be a nurse or the doctor whoever is giving the drug. That is the administration phase. During all these phases, the chances of errors are more. In the slides, we can easily see during the prescribing what are the chances of errors it goes wrong. One is wrong dose, wrong drug, wrong route, or the not knowing the allergy and not able to understand the drug-to-drug interaction. During the transcribing, apart from those all, we all know the dose, drug, route, but there is a chances of selecting a wrong patient when you're doing a entry into the system. Then when it comes to the dispensing, covering all the errors which can happen during the prescription and the transcription. During the dispensing, chances of mislabeling, selecting a wrong drug, the pharmacy capturing a wrong drug and doing into the dispensing. Then when it comes to the administration, each step, error, there are the chances of error where actually we can prevent. But the final checkpoint for the drug error to prevent is the administration step, where actually we have to ensure we have a correct dose, correct route, and what is the dosage written for the patient. We have to know the allergies of the patient, the labeling we have to cross check, we have to cross check the expiry date of the drug. All these things can be cross checked and errors can be prevented. At the last step, that is a checkpoint, is with the administration. It lies with the doctor or the nurse whoever is administering the drug to the patient. Next slide. So let us understand. Now we have know what are the steps involved in the medication management process. As a point of nursing, what actually administration involves. It is not just taking the medication and giving to the patient. No, we should have a information about the medication, what we are actually giving to the patient, what is the indication, and what form we are going to use that medication. It may be a tablet or the injection or the liquid form or the powder form. Then we should understand the calculation. If it is a calculation based on the dose or the body weight of the patient, it may be inotropic drug. We should really understand how much mg the doctor has been prescribed, how we are going to mix the drug, what is the dilution, how we are going to label the drug so that it's easy to understand. Then in the same way, we have to prepare the drug. Then checking the allergic status of the patient and following all rights of the medication administration. Important is documentation. Next slide. So as we already know 10 steps as per WHO, Dr. Zia sir has already taken through us. Let us understand some of the important strategies where we can implement as a nursing fraternity to reduce the medication errors and prevent the medication errors. Next slide. So first is minimize the clutter. In a nursing station or in an impress stock, we have so many medications which has been segregated properly into the boxes, into the racks, in the alphabetical format. But very often when we are busy, we fail to organize those things in a way where it should actually be. So where the chances of error when we go in a rush, if it is cluttered completely over there, we don't know what we're picking up from there. So we have to organize our stock at the patient bedside, at the nursing station counter, where the pharmacy will dispense the drugs to us, and the impress stock also. And we already know why we have to minimize the clutter, because our patients have been demanding, because the moment we tell the drug need to be given, immediately they think that it has to be given by next 5 to 10 minutes. So we should not be in a rush to understand and follow the 7 rights of the medication. Second is verify the orders. We have to read all information and clarify something really we are not understanding. For example, as a basically any experienced staff, we do understand as a register nurse, the dose of the diuretics will be less. Maybe 10 to 40 mg or the 60 mg. Suddenly we have said 100 mg has been written for a patient. So with an experience, we can understand whether the dose is really correct to the patient. So if really you are not understanding, there is some confusion, go back to the doctor who prescribed the order, verify with the clinical pharmacologist who is available in our hospital. Third one is use of barcodes. In some hospital it has been implemented, in many hospital it yet to be implemented. So using a barcode system, as we see in the supermarket, the moment we see a particular product, we do the barcoding and the product reflects in the system. In this way, we are ensuring that the product which is there in our hands is exactly what we are going to give to the patients. So use of a barcode systems really helps us in reducing the medication errors. Next slide. So be aware of look-alike and sound-alike drugs. As I mentioned, when a product is there, the products in the supermarket or the pharmacy also, we have similar many drugs. Many ampoules will be looking similar, many tablets will be looking similar. So how we are going to differentiate that? So where we have a organization policies in place with the look-alike and the sound-alike drugs, we have to make a list of all look-alike, sound-alike drugs which we are using in our hospitals. And those drugs need to be labeled with a tall man letters, and it should be stored with a separate racks in a separate box, so that it is easy for the nurse or the doctor to understand what the drug they are taking. And even if you are taking also, as the name itself says, look alike and the sound alike. So the moment you see it is stored in a different color boxes, we understand that I need to double check what drug I am picking up from the impress stock. Then have a second pair of eye check prescriptions. We always think second check is only for the narcotics or the high alert medication, otherwise some costly drug. It is not like that. For each and every drug, having a second pair check with the seniors or the doctor on duty or the clinical pharmacologist will make us to understand what drug actually we are giving for the patient, and is it is a correct dose, correct form, and are we giving correct to a correct patients. So we have to involve a second human final check, and we have to verify those with the written order by the doctor whoever has been prescribed the drug. Then proactive, being proactive, it means that let's not keep waiting for the things to go wrong, fix them before it happens. Example, now the example I have said about the diuretics, you understood 100 mg dose is not correct for a patient. So you should not keep quiet and give, okay, this is doctor has been written, otherwise it has been already issued from the pharmacy, let us give. No, if you have a doubt, be proactive, go back to the doctors and ask whether it is a correct dose or not, because simple changes can have a big impact in preventing a medication errors, which is we are going to stop a near miss or the error happening to a patient in our hospital in our hands. Next slide. Design effective warning system. This designing effective warning system is a software related where we are using some drugs where there is a look-alike and sound-alike drugs, where the software will give us the alert saying that, see, this is a it automatically reflects saying that it is a look-alike, sound-alike drug. Otherwise, there are so many drugs where drug-to-drug interaction may be there to the patient. So designing an effective system where the drug-to-drug interaction will be captured the moment the two drugs are there for similar patients, so that the moment the system gives us alert, everyone will be noticed, so that the cross-checking will be done at the behind, and what need to be done will be taken care. Involve the patient. The patients are there. They are the last line of defense when it comes to the medication errors. The moment you tell the patient, like, I'm going to give you the diuretics now. I'm only taking the diuretics example because in the continuation, it's easy for everyone of us to understand what we are doing. So you're going to tell the patient, this is the diuretic for what we are giving now. The moment you say, if the patient really understand, he may say just before 1 hour only or before in the afternoon only dose has been given. Is the second dose what doctor advised? So the check is a final defense by the patient The moment you start involving the patient, educating the patient and explain the indication for what the drug is being given, it gives a one more alert to stop. Really is I'm giving the double dose, otherwise the dose has been given at the wrong time. Really are you making any near miss to a patient, any error is happening? So the final checks also can be done by involving the patient. Next slide. Trust your gut. It means, as I have told, being proactive. When you receive a prescription, especially if you get to know about the patient completely and you feel that something is not good in that prescription, you understand the dose, because we are graduate from the nurses. Everyone will actually basically understand the normal doses of some drugs. So let us don't sit calm, have trust, because you know the knowledge, you know the clinically the patient better. Go back to the doctor and explain, call the doctor and explain, this is what we have seen. Maybe there may be error, or take the clarification, maybe because of the patient medical condition, those drug need to be given or not. So trust your gut, receive, call back the prescriber. Don't be silent when you notice something is not going good. Then track the medication error. Our Zia sir was telling, in our state or India, there are many errors has been underreported. So the moment we start tracking the errors, as I mentioned in my first slide, the moment there is a error, if we escalate, it is a chance, every chance where we are lacking, there is a chances of improvement. The process can be viewed, RCA can be done, where we are going back, where are we lacking, all can be kept it in one place. We can implement a process where actually we can reduce these errors. Next slide. So as these are the 10 important steps as a nursing point of view, we have to keep it in mind where we can actually reduce in having a medication errors. Then develop a checking habits. As we already know, we have rights of the medication, we have an administration process, administration policy in the place. We know the medication management process, but still we should have some checking habits where actually we can verify each and every step for the medication administration. So those checking habit, when prescribing a medication, when administering the medication, we have to check for the allergies. We have to follow all rights of drug administration and make it as a habit that we are going to check all 7 rights during each and every drug administration. Then if there is any drug you find which is not labeled, kindly discard that in the bin, because you are not sure what drug it has been loaded, who loaded, because there is no label. Without any label, you have to think that has to be gone into the dustbin. Never administer a medication unless you are 100% sure what you are giving as per the drug chart. Then start these checking habits from today, so that we are not going to cause any medication errors towards the patient. Next slide. So as I've told in the STEM strategy, one of the important strategy is to involve the patient and encourage the patient actively involved in the process of the drug administration. When like we have to tell them what is the name of the drug we are giving, what is the purpose. Like example, again, I'm taking the diuretic. This is the diuretic drug. As maybe your output is low, we are giving you this drug and the action of the drug, when it is going to start, what is the dose we are going to give, how we are going to administer, after that how we are going to monitor you. So that these all, when we encourage the patient, when we involve the patient, the next person whoever is going to give that particular drug, the patient is confident that drug has been given correctly to him in the way what has been prescribed, in the way what need to be given. Next slide. So let us understand what are the situations we are most likely to contribute to have a medication errors. Next slide. There are some, not all. I'll just brief on some situations where actually the medication error may happen, but if you follow the checking habits and the 10 strategies to prevent medication error, even with this situation also, we can prevent medication errors. So first thing is inexperience. Inexperience means it is not that we have done our graduation, we came fresher to the system. No, even you're fresher to the system, your clinical knowledge, what we have learned in the nursing, having a drug clearness, like if some particular drug is there for what we are giving. So if you are not that much experience in understanding what drug actually I am giving, so there is a chance that we may contribute to medication error. Rushing, maybe this drug, patient is coming and asking for the drug, doctor is telling us to give fastly, Otherwise, maybe my shift is going to end, I have to give the drug fastly. No, never be in a rush to give any medication or anything to your patient, because if you're in the rush, both your safety and patient safety will be compromised. Like doing two things at once. Maybe you're loading the medication by seeing the drug chart and talking with some other friends or the colleagues because they're coming and asking you some doubt. No, when you're doing something related to the medication, please tell them, please do not disturb me as I'm loading medication for my patient. It is for the patient safety. Then minimize interruption. Then if you're fatigued, take help of others or the seniors so that medication errors can be controlled and preventable. Next slide. And being automatic pilot, failure to check and double check. As I have told, if it is a look-alike, sound-alike drug, otherwise it is a high concentrated electrolytes or the narcotics. Unless you are not having a double check mechanism, the chances of error will be very high if you're not following the double check mechanism. Then lack of poor teamwork, communication between the colleagues, reluctance to use memory aids. These are the some situation where it will contribute to medication errors, but these situation can be overcome by following the checking habits, for following the 10 strategical steps what I've shown in my previous slides. Next slide. So many literature states that nursing is not just knowing the medication right, saying that I know 7 rights, with the 7 rights medication errors will be prevented. No, as a nurse in this emerging situation, we should have a critical thinking. We should take a role of the patient advocacy by involving the patient, clinical judgment, and the nurse experience as it relates to the decision making capability. Next slide. So we have to safe medication administration is said to require much more than the rights of the drug. As I am mentioning, not just knowing the rights of the drug, we are not going to have a zero medication errors. We have to have a critical thinking. We have to have a patient advocacy, involve the patient, understand, have a drug knowledge, so that we can avoid costly errors in view of medication management. Next slide. As I mentioned, literature is gradually showing that importance of the nurses has been highlighted in every research, where we have to have a critical thinking. We should have a basic knowledge about the drug and the drug administrations. We should have a clinical reasoning for what the drug is being given to the patient. And we should have a competency for a nurses in view of the clinical pharmacological knowledge, clinical experience. We should be able to have perform comprehensive situational assessment for patient before medication administration. Next slide. So as I have told, the moment we have a patient safety and the quality, which includes both employee safety also, the moment we are following all this, we are going to deliver a high quality patient-centered care and overall well-being of a patient. Medication errors are unfortunately very common in clinical practice, but if we follow all strategical steps and the checking habits, we will be not compromising on the patient safety. And in case if that happens, it will be compromising the patient safety and also extremely costly for the hospital, and it increases the hospital stay. The third step shows the disability. Many medication errors resulting in the adverse drug events may cause disability at the discharge, or may happen death or extended hospital stay. That is the results of healthcare management, where because of one simple error not following the check mechanism, we are going to increase the stay of the patient in the hospital. Indirectly, it is costly for the hospital also. Next slide. So let us understand the summary. Next slide. So medications can greatly improve health when used wisely and correctly. As I have said, if it is overdose, underdose, and in case if you are omitting the dose also, we're not going to do any benefit to the patient who are in our hospital for a safety. Then each step of medication administration process plays a vital role in prevention of medication error, starting from prescribing, transcribing, dispensing, and administration. Remember, like we have each a checkpoint of prescribing, one checkpoint of dispensing, transcribing, dispensing, and administration. Last checkpoints ends with administration. If we are alert at the last checkpoint, we can stop medication errors, we can prevent, we can make it zero medication errors. Follow 2 check mechanisms, involve the patients, and please implement the strategies. Make it as a checking habits. Next. Thank you. Thank you, ma'am.
Thank you so much, Ms. Bhagya Lakshmi, for your valuable insights on the basic tips on the medication management processes, especially from the nursing perspective, and also the effective strategies to reduce medication errors. Now the floor is open for question and answer session. You may drop in your questions in the chat box, and the speakers would respond to your questions. So to take the first question, there was one question for Ms. Bhagya. It was something to do with the medication side effects that you have. The medication side effects that you have, along with that, basically they're looking at the actions. The question was like, how to communicate as a nurse about the medication side effect and actions, because the patients can grab only information about side effects and not about the action, drug action. So what do we do as a nurse?
As a nurse, we have to first educate the patient, and patient is having all rights to understand what medication he is taking. And in any situation, in case if I'm giving a diuretic, I have to educate the patient. This is for this reason we are giving a diuretic. And side effects we have to tell them, because the chances of increased urination is there. So in a simple, understandable language, not as a complete medical knowledge, we have to tell them, if you give diuretics, you may land up in hypotension, you may have a dehydration. No, in a simple language, you have to tell, maybe the one of the side effect may be increased frequency of the urination, and indication is for the diuretic, maybe because of your fluid overload. Otherwise, as your output is low, we are giving this drug. We never say complete side effect of each drug. In case if you are saying complete side effect of each drug, starting from a simple tablet Dolo to the costly antibiotics, also the major side effects will be there. But the patients will never expect those side effects to be educated and known by them. A simple side effect which you want them to understand, those side effects, if you brief, that will be okay. If any suggestion, Zia sir can actually help.
Yeah. So adverse side effects of patient education. What you have mentioned is educating the patients about the possible side effects with the use of the medications, and watch for some warning signs, especially for example, in cases if the patient is on anticoagulants, then watch for warning signs of bleeding, or bleeding from the gums, or the bleeding from any mucosal areas, which needs to be educated to the patient of having the, and especially other food drug interactions and drug interaction, which are the foods, which are the drugs to be avoided, because that also can lead to a adverse outcome. So that education is.
Thank you so much. Another question I have got from one of the audience is basically related to the effectiveness of medication reconciliation process. As Dr. Zia has explained very beautifully, but then in most of the hospital, we are able to see that there is still a gap on complete medication reconciliation, because of which there are some errors that has been observed in the hospital. So how do we streamline this process of effective medication reconciliation during the transition of care?
Yes. So medication reconciliation, I have mentioned that it's a very complex and challenging area with any hospital which they face, which happens because of many challenges, starting from the adaptability from the doctor's point of view, and identifying the challenges. That would be the main thing, like identifying respect to that particular unit. For their own unit, what is the challenge in implementing medication reconciliation? How is it happening? Is it the doctor's attitude over the medication reconciliation at the time of admission or shifting the care or a discharge, or else is it the information gathered from the patients and patient attender? And creating a standardized template, medication reconciliation template, and implementing in the hospital at the transition points of care, where the reconciliation can happen in a standardized format, like name of the medication, last dose, date, time taken, and whether it has to be continued or not, and what is the source of this list of medication, whether it is from the physician list or is from the patient side, and and then what is to be done, whether it has to be continued during the hospital stay or not. During the hospital stay, mostly the reconciliation discrepancy won't happen when the hospitals adapt to a uniform location where the drug orders will be returned on the day-to-day basis, and the standardized template, the drug cardex, the drug chart in a standardized format implementation, that also significantly help reduce medication reconciliation discrepancy, when the patients are within that particular unit for a longer stay. The next challenge which comes when the patient is getting shifted or transformed from one unit to other unit. During that time, the reconciliation discrepancies which seen mainly related to the ICU and the ward medications, where the handing over and communication between the staffs needs to be very clear and need to be having a standardized template there for patients handing over and the medications update which next dose when it has to be taken and continued. And during the time of discharge, when the reconciliation happens, the discharge medications need to be in sync with the existing drug chart and correlate with the medication reconciliation at the time of admission and to ensure any discrepancy at the discharges. The more advanced solution for the reconciliation would be having a very good robust hospital information system where with one unique hospital ID, the patients get tracked from the time of admission till their discharge. If the same patient comes back to the outpatient setting in the outpatient consultation, the system should be able to alert and pop up the reconciled medication within the system and help the prescriber to know that this medication patient was on and this medication he has stopped at this stage. So this would be many these were strategies and some of the points which can help you implement and improve your existing hospital medication reconciliation and prevent discrepancies and errors happening with this reconciliation discrepancies.
Thank you so much, Dr. Zia, for the wonderful insight on this medication reconciliation process. I'm sure many would be benefited out of this, and also Ms. Bhagya for an elaborate session on nursing medication management as well. So would request, can you please put up those last two slides, Dr. Zia?
Yeah, sure.
So, for the audience, please stay tuned for the upcoming Knowledge Series webinar till 17th of September. Tomorrow's topic on the webinar is on hands-on approach to the safety of high alert medications at 3 p.m. And this is the detail of the presentation that will be running tomorrow. And those who would attend the webinars for the next 6 days would stand a chance to win a lucky draw and would be eligible for free registrations for our upcoming 9th International Patient Safety Conference in Delhi on 1st and 2nd Feb 2023. And we shall get in touch with the winners shortly. And regarding this 9th upcoming International Patient Safety Conference in Delhi, that would be held on 1st and 2nd of February, for which the pre-registrations are on. You may please check on the details on the given website or send in your queries at the given email or call us at the given number. The early bird may also have a chance to get a discounted registration for the conference. And I would like to thank each one of you for your active participation and patient learning. Thank you very much.
Thank you, Rekha, for coordinating and moderating the session. Thank you, Bhagya.
Thank you, sir.